I'm Laura Shu with Oculogica, and you've joined today's webinar on the concussion diagnosis and insurance in the HeadStrong states. So let's get started. First, we'll talk about what is HeadStrong, then we'll discuss the EyeBOX and the clinical and financial implications for your practice. Then we'll end with a question and answer session. So if you have questions during the presentation, feel free just to pop them in the Zoom Q&A box. You don't have to wait till the end. Please allow me to start with some introductions. Our speakers today are Rosina Samadani. She's the CEO of Oculogica. Hi, Rosina.
Hi.
Oculogica is a concussion diagnostic company. They manufacture the first and only objective test authorized by the FDA as an aid in the diagnosis of concussion. Also joining us today will be Christian Reed, CEO of Dissinger Reed. Hi, Christian. Dissinger Reed is a special risk agency that focuses specifically on the unique insurance needs of college athletic departments and high school associations. So to start things off, I'd like to do a quick poll. So can everyone see that? So what we'll do is, if you would, select yes.
I don't see it,
You
Laura,
don't see it, okay.
Yeah, so I don't know if everyone else sees it. Nope, Margaret says that she doesn't see it either.
Not sharing, all right. Let's try it one more time. Poll question one. Relaunch, there we go. All right.
Yeah, now we see it. Yep.
Okay. And then at the end, if you answer, I'll share the results with everybody else. Who has heard of the HeadStrong program? All right, answers are still coming. I'll wait just a moment more. All right. So it looks like about half and half of who's heard of HeadStrong. All right, now I'd like to pass it over to Christian Reed to discuss what the HeadStrong program is. Christian.
Well, thank you, Laura and Rosina, for including us today. Certainly appreciate Dissinger Reed being included in the concussion discussions as they're out there now. And all of those youth participants that it is our goal to try to cover as many as we can. As Laura mentioned, Dissinger Reed, we've been specializing in college and university and state high school association insurance business for nearly 4 decades now. So we currently work with over 200 colleges and universities and 27 state high school associations across the country, which includes the governing body of all high school participants in the National Federation of State High School Associations. So concussion, certainly to me and my associate Justin Vandewinkle, is near and dear to my heart. Is I had twins that were born about 10 weeks premature. Both suffered level 2 brain bleeds. So the neurological follow-up care, basically concussion care that I saw from their birth 14 years ago, has really stuck with me. And that's why we initiated the HeadStrong Concussion Insurance Program, specifically for high school youth participants and those young athletes participating across the country about 6 years ago. So, I mean, as you can see, we are currently up to almost 700,000. That number's a little low there, but we're extremely proud that we do have nearly 700,000 youth participants on the HeadStrong Concussion Insurance Program. I think we're more proud of the fact that we have paid over $2 million for the HeadStrong concussion claims since 2015. And really why we started the program is, you know, the college and university market, they have concussion care under their student athletes in their secondary athletic insurance plan. But we initiated the discussions with our carrier because what we were seeing is that the high school and the youth sports level is in some of the socioeconomic challenged areas, they were either not reporting concussions and the kids were going without care, or they would not follow up with concussion care because they thought it was too expensive and the parents weren't going in for the neurological follow-up care or the concussion care that they really needed. So we started out with a couple of states. And Laura, if you want to go to the next page, you can see now of the 27 state high school associations that Dissinger Reed writes their insurance for, 11 of them are currently participating with our HeadStrong concussion insurance program. And And you can see the states there. They've come on at different times and for different reasons, but basically a lot of these states just didn't know what their member institutions were doing for concussion care. They felt that within their mission to protect their young athletes for either high school, some of the states that do go down to the middle school or grade school level certainly can cover their youth participants with HeadStrong. They decided to come on board, and these states that we're discussing today are at 100%, which means all of their student athletes within their given participating organization are covered by HeadStrong. We do have some states that do it on a voluntary basis, and they let us know what specific districts may come on board, what they need as far as coverage goes, and we take care of both. Justin and my mission is to get, our ultimate goal is to make sure that every student athlete across the country, which is over 12 million participants, at some point, we know that they all have the concussion coverage that they need. So Laura, if you want to go to, the next page here, as you see, basically goes over what Justin and I have put together for the HeadStrong Concussion Insurance Program. And as you can see, we cover up to $25,000 per participant of concussion-specific insurance. We wanted to do it with a carrier that also believed in our mission. So we have a zero deductible. There are no co-pays, no out-of-pocket expenses. And that's great because a lot of the times the parents don't have the means to go in and have this care. So this program will take care of that. We're very excited that our carrier, Mutual of Omaha, has agreed to underwrite this program for only $1.35 per participant per year, which is phenomenal. As we all know, healthcare costs are rising. Medical trend and inflation is going through the roof across the country. So at the end of the day, whether it's the neurological follow-up, any telemedicine, and $25,000 of concussion insurance is all for $1.35. So we ask our states, whether it's youth hockey, youth soccer, whoever we're being involved with, is to maybe skip that cup of Starbucks for 1 week and talk to your associations about how important the concussion care can be for these youth participants, and somehow try to get involved with our HeadStrong program. So, very basically, hopefully that's a little bit in a nutshell of our HeadStrong Concussion Insurance Program, and really the footprint that we're trying to expand across the country, state by state. We can very briefly, a lot of you may say, well, how does it work? What do we do? Well, when they're in 100% participating state, that means that the concussion care is paid for. And if someone were to experience a concussion, they would report it to the trainer or administration. Our costs cover the initial ride to the healthcare provider, whether that's a hospital or an emergency room, the ambulance care, if there is an overnight stay, and concussion monitoring, if it's a bad one. All of those things are taken care of. Then from that standpoint, the parents may get their bill, they may get their explanation of benefits, their any itemized bill or reoccurring amounts due, and they send that into a claim form to our folks at Mutual of Omaha. And if there is primary insurance, we always try to go primary. The HeadStrong program is secondary to any other valid and collectible insurance. So if there's primary, we utilize that. If there is not primary, then our HeadStrong program comes up and picks up at 100%. And that's all sent to our claims payers at Mutual of Omaha. We know there's going to be reoccurring costs associated with a concussion. So whether it's neurological follow-up, your primary care follow-up, we know that individual states have different licenses that are allowed to perform services for concussion. So any of those that are creating bills, if there is a confirmed CPT diagnosis code of a concussion, all of that can be sent into Mutual of Omaha and paid at 100%. So, yeah, that if there are any questions, we can certainly tackle those at the end of the Q&A with Rosina and Laura. But we're very excited to be a part of this, and And anytime we have a opportunity to partner with someone like Oculogica and what they're doing for the medical attention to our participants across the country, we love spreading that word.
Thank you so much, Christian. That's a lot of great info there. All right, let's change gears a little bit and do another poll. We're going to talk about the EyeBOX. So who has heard of the EyeBOX or of Oculogica? Hit your responses and I'll share the results with everybody. So we'll give it just a moment here. All right, anybody else? All right. Can you see the results? Looks like most of you have actually heard a little bit or something about us. Okay, now I'd like to hand it over to Rosina to dive into some details for us.
Thank you, Laura. And thank you so much, Christian. So helpful. And I'm so glad that the program was started because we talk to parents, as you do, all over the country. And a program like that is just it's a godsend. So it sounds like a lot of you have actually heard about the EyeBOX, so I'll make this actually pretty quick. We are an FDA authorized aid in the diagnosis of concussion. We don't replace your full concussion test. We provide additional information. We are FDA cleared for both the pediatric and adult population. The technology itself was discovered by a neurosurgeon, and it's based on the correlation between cranial nerve function and eye movements. So this is not a volitional test. This is a measure of your actual cranial nerve function. And our company itself is funded by Titletown Tech, which is a joint fund between the Green Bay Packers and Microsoft. And we've also received some funds from the Department of Defense. So, we're here for the long term. We're here to not only launch this technology, but the follow-on technologies. Laura, you can go to the next page. So the way that the test works is that it is just under 4 minutes. The patient watches an engaging 220-second video clip. And I'm going to actually show you the test on the next slide, but let me just go through the rest of these first. Sorry, Laura, I think just back up. During that test, the EyeBOX device collects their eye movements with a safe high-frequency camera, and then a score is instantly generated, and that score is between 0 and 20. Less than 10 is considered normal, greater than or equal to 10 is considered abnormal. And now, Laura, if you could go to the next page. So this is just a quick video clip of what the test looks like. As I had mentioned, it's just under 4 minutes, 220 seconds. The patient is watching a video as it moves around the screen for 5 cycles. We've sped it up here for the purposes of this demo. And their eyes are being tracked each individually. And then as soon as this test is done, the patient's job is done and they can sit back and relax. You'll see that this patient will do that in just a moment. And a report is generated. And there are a number of numbers in this report, a box score, and we show some detailed information about the eye movements. So that is the test. You could just go to the next slide. Thank you. The clinical implications for your practice are really threefold. You get an additional objective piece of information to inform your concussion diagnosis. So it's interesting that Christian said that patients were, or parents were not reporting, not following up. We see this as a very important first step in whenever a patient comes in, is that they should get an EyeBOX exam so that you know exactly where they stand right now. That score gives your patients and you peace of mind, and you can monitor your patient as they recover. You can watch that score hopefully get better. You're also getting a validated research-backed diagnostic with developments being presented right now at conferences by thought leaders. So we've been doing research for years. A lot of that research is reporting out now and is being reported at conferences nationwide, most of those via Zoom, but some of those in person. And there will continue to be research conducted and research reported out. If you go to the next page, we've got some examples. So we hear from parents all the time, as I'm sure Christian does as well. And I just wanted to share 2 quotes with you. The first one here on the left, "I'm so grateful. I didn't know what to do. The trainer wouldn't see him because we didn't have a baseline test. I felt really stuck not knowing exactly what was going on. It was so reassuring. It was really simple and eased his anxiety." This was a kid who was on the football team. That year, COVID was going on, so they didn't do their impact baseline test. He was in the weight room doing training, and a bar was, fell on his head. They really did not know where to go. The emergency room wasn't really that helpful. He didn't have a baseline impact test, and we were able to get him to an EyeBOX that happened to be in the same city. And the reassurance and the calm that they received by getting not only that test, but then a couple of follow-ons was, was wonderful. And it was very helpful to them to know that it wasn't just in their mind, that something actually was going on, and that indeed their kid was getting better. On the right, the day of the baseline test, this is a different person. The day of the baseline test, he got hit in practice in the afternoon. After another test, his score jumped significantly. He was tested repeatedly over the following months, and I was reassured as his score gradually declined. You're like, okay, obviously he's getting better. This is an interesting case. It's another football player. And that day we just happened to be doing baseline testing with the EyeBOX of the entire football team. And this kid, a ninth grader, got hit in practice that afternoon, and we ended up seeing him in the emergency room, and there was an EyeBOX there right on site. And they were obviously able to see the difference, 12 hours later after after he'd been hit. And then he was monitored over the next several weeks, and it really gave both him and his parents peace of mind that he was getting better. Laura, you can go to the next slide. So the financial implications for your practice, really bringing both Christian's and my talk a little bit together. Every practice is different, and I'm just sharing some illustrative numbers here with you. We can do a custom financial analysis for your practice. So you can just get in touch with Oculogica. We'd be happy to do that. One of the first things that we would do is just talk about who your patients are and what type of insurance coverage they have, if any. Our clinics are charging a certain amount per EyeBOX scan, and that amount ranges generally from $250 to $450 per scan. The reimbursement levels are dependent on what they submit to the insurance company and what kind of insurance company that is. So it goes from Medicare all the way up to workers' compensation and personal injury, and you can see some of the numbers there. Laura, if you can go to the next slide. The break even, if you are seeing high school patients, and in some cases, in some states, even younger than high school, is dependent on the amount that you're charging per scan for the EyeBOX. And we are assuming that you're seeing this patient 1.5 times per month. We are finding that most patients are being seen twice per month once they have a concussion. The first time to get diagnosed, and then hopefully a return to play visit. They may have a couple more visits if the concussion is prolonged. And if, for example, you're charging $200 per scan, you need to see 5 high school students in a month in order to break even with the EyeBOX. If you're charging higher, $400 or $450, you need to see 2 high school patients per month. Laura, you can go to the next page, and that's it.
All right, thank you, Rosina. Thank you, Christian. Now we'd like to jump over to the Q&A. So if you have questions, please just throw it in the Q&A box in your Zoom screen. And we have 2 questions. All right, Christian, first is for you. What type of insurer is Dessinger Reed? Example, MEWA, AHP, other?
So Dessinger Reed is a special risk broker. So I am able to go out and solidify my carriers, some for college and university, some for state high school associations. A lot are accident medical, some are general liability. For this specific program, this is an accident medical program in which I go to Mutual of Omaha. We've got a great relationship with them on both the high school catastrophic level and also on the intercollegiate college level. And Mutual shares my mission for concussion coverage. They are the ones that underwrite it, and I work directly with Mutual of Omaha myself.
Fantastic.
Does that answer the question?
Hopefully so. If you need clarification, please just ask for it in the Q&A again. All right. Good question. Paul, we have another question, this one for Rosina. Can a patient intentionally screw the result? Can pre-existing gaze abnormalities result in an abnormal EyeBOX score?
So it's very difficult for the patient to intentionally skew the result and for the operator or healthcare provider not to notice that. To intentionally skew over the course of 220 seconds, 5 cycles as your eyes are required to do something is extremely challenging. We actually have not been able to find anybody that can do that. The reason for that is that it's difficult to get your eyes to intentionally move differently than each other, the left eye and the right eye. The pre-existing gaze abnormalities, there are some that are that are very difficult to get a good EyeBOX score with. One of them is strabismus. And so we've got a small list of items that you need to check that the patient does not have before you would use the EyeBOX on them. And I think that there was another question about EEG that I saw somewhere.
Yes, how does the EyeBOX compare to the EEG?
Yeah, so there are several devices out there for EEG. Their indication is for positive head CT, which is a structural brain injury. Concussion is not a structural brain injury. It is a completely different type of injury. So if you've got a positive head CT, you've got a structural brain injury. If you've got a negative head CT, you can still have a concussion. It is a, it's a different type of brain injury. The EEG tests that are out there are 99%, very high sensitivity, but not such great specificity. Our test has high sensitivity, high specificity for concussion. The EEG has a high sensitivity for a positive head CT. It is not yet indicated broadly for concussion in both pediatrics and adults. I think one of the tests has done a very narrow population of 18 to 25-year-olds in which they've been able to show some sort of correlation with concussion, but it's not broadly applied. Hopefully that answers people's questions. People are obviously welcome to follow up.
Thanks, Rosina. Another question for you. Is the system portable to travel to multiple locations?
Well, it depends on how strong you are. Right now, the version that we have is really intended for a clinic or an emergency room, and you can wheel it around on a medical cart. We are working on a much smaller version, but that's not going to be out this year.
All right, great. All right, how about CPT codes?
There is a CPT code, and we can provide that to you. It is 0615T, and we have an entire reimbursement structure to support reimbursement. And so happy to provide all of that information to you. We've got, a support line and letters and materials so that you can, get reimbursement.
Fantastic. Christian, does Dissinger Read pay for baseline exams at the beginning of the season?
We do not. We leave that up to the participating organization. Everybody is a little different, and youth soccer or youth hockey may be different than a state high school association that is allowing their districts to utilize whatever baseline test that they have an agreement with. Some do it in bulk. Some do it individually with a specific provider. We do not pay for that. We leave that up to the states. And that's one thing that if there's not a baseline test involved, that's why we felt this was important, especially with the concussion coverage, because if there's no baseline test, that doesn't mean that our insurance is going to deny it. There doesn't need to be a baseline test in place in order to put the insurance through the HeadStrong program. There's no requirements.
Yeah, and I just want to add to that. So with our exam, you can have a baseline, but if you don't, you're completely fine. You can still do the test. There's no baseline required to do the EyeBOX exam.
Great. Thank you. Another question. Can you confirm the CPT? The number again, Rosina?
Oh, it's 0615T. And if that person wants to get in touch, we can send our reimbursement FAQ so you have more information.
That sounds great. Great. How often can you test and bill after a concussion?
You know, I am not a payer expert. The payer for that particular patient is going to put any restrictions on there. We have not heard of any restrictions, but I'm sure the payers would have something to say about that. But unfortunately, I'm not an expert on the, you know, on the each individual payer.
Okay.
We have not had problems with people testing and billing multiple times after a concussion. So if that's any help.
Okay, other questions? Give just a moment to let any more come in, and then we'll wrap it up. Okay, do you assist with referral to offices for local EyeBOX?
We do, just on an ad hoc basis. We obviously did for one of the patients that where we quoted, and we absolutely want to get these patients to an EyeBOX. I'll just tell you that personally, I get a call every single weekend from parents saying that their kid has a concussion and where can they get a scan. So that happens, unfortunately, without fail. Every weekend. There's a lot of kids out there doing stuff.
Great. Okay. Christian, Rosina, would you like to add anything else before we close out?
I see another question here. Can you discuss pricing on this chat? I'm happy to talk with you one-on-one. We do charge, the way that we charge is on a monthly basis, and you can use the device unlimited. And happy to give you that price. I think it's Mark that's asking. Just get in touch with us and we'll do a quick call.
All righty, sounds good. Christian, anything from you?
No, I just would like to thank the participants that were on today and their interest in taking care of our youth and our sports participants across the country. It's extremely important. You all are doing the right thing, and however Dissinger Reed can help on the insurance front, Justin and I are happy to have any conversations and help Oculogica, any associations. We're always here to help.
Same here. Thank you so much. Really appreciate the interest in taking care of kids.
Thank you all. Take care.
Thanks all. Take care.
Thank you.